A nurse is giving instructions to a patient who will be receiving oral iron supplements. Which instructions will be included in the teaching plan? A. Take the iron tablets with milk or antacids. B. Crush the pills as needed to help with swallowing. C. Take the iron tablets with meals if gastrointestinal distress occurs. D. If black tarry stools occur, report it to the doctor immediately. Answer. C. Take the iron tablets with meals if gastrointestinal distress occurs. Rationale. Although taking iron tablets with food may decrease absorption, doing so helps to reduce gastrointestinal distress. Antacids and milk may cause decreased iron absorption. Iron tablets must be taken whole and not crushed. Black, tarry stools are expected adverse effects of oral iron supplements. The nurse is reviewing the medical record of a patient before giving a new order for iron sucrose, Venifer. Which statement regarding the administration of iron sucrose is correct? A. The medication is given with food to reduce gastric distress. B. Iron sucrose is contraindicated if the patient has renal disease. C. A test dose will be administered before the full dose is given. D. The nurse will monitor the patient for hypotension during the infusion. Answer. D. The nurse will monitor the patient for hypotension during the infusion. Rationale. Iron sucrose, Venifer, is an injectable iron product indicated for the treatment of iron deficiency anemia in patients with chronic renal disease. It is also used for patients without kidney disease. Its risk of precipitating anaphylaxis is much less than that of iron dextran, and a test dose is not required. Hypotension is the most common adverse effect and appears to be related to infusion rate. Low-weight elderly patients appear to be at greatest risk for hypotension. An oral iron supplement is prescribed for a patient. The nurse would question this order if the patient's medical history includes which condition? A. Decreased hemoglobin. B. Hemolytic anemia. C. Weakness. D. Concurrent therapy with erythropoietic. Answer. B. Hemolytic anemia. Rationale. Hemolytic anemia is a contraindication to the use of iron supplements. Decreased hemoglobin and weakness are related to iron deficiency anemia. Iron supplements are given with erythropoietic drugs to aid in the production of red blood cells. A patient has been taking iron supplements for anemia for 2 months. During a follow-up assessment, the nurse will observe for which therapeutic response. A. Decreased weight. B. Increased activity tolerance. C. Decreased palpitations. D. Increased appetite. Answer. B. Increased activity tolerance. Rationale. Absence of fatigue, increased activity tolerance and well-being, and improved nutrition status are therapeutic responses to iron supplementation. The other options are incorrect. The nurse will teach a patient who is receiving oral iron supplements to watch for which expected adverse effects. A. Palpitations. B. Drowsiness and dizziness. C. Black, tarry stools. D. Orange-red discoloration of the urine. Answer. C. Black, tarry stools. Rationale. Black, tarry stools and other gastrointestinal disturbances may occur with the administration of iron preparations. The other options are incorrect. A patient has been receiving Epoetin alpha, Epogen, for severe iron deficiency anemia. Today, the provider changed the order to darbepoetin, Aranesp. The patient questions the nurse. What is the difference in these drugs? Which response by the nurse is correct? A. There is no difference in these two drugs. B. Aranesp works faster than Epogen to raise your red blood cell count. C. Aranesp is given by mouth, so you will not need to have injections. D. Aranesp is a longer-acting form, so you will receive fewer injections. Answer: D. Aranesp is a longer-acting form, so you will receive fewer injections. Rationale: darbepoetin, Aranesp, is longer-acting than Epoetin alpha, Epogen, therefore, fewer injections are required. The other options are incorrect. A cancer patient is receiving drug therapy with Epoetin alpha, Epogen. The nurse knows that the medication must be stopped if which laboratory result is noted. A. White blood cell count of 550 cells per cubic millimeter. B. Hemoglobin level of 12 grams per deciliter. C. Potassium level of 4.2 meq LD. Glucose level of 78 milligrams per deciliter. Answer: B. Hemoglobin level of 12 grams per deciliter. Rationale: if Epoetin is continued when hemoglobin levels are above 11 grams per deciliter, patients may experience serious adverse events, including heart attack, stroke, and death. Guidelines now recommend that the drug be stopped when the hemoglobin level reaches 10 grams per deciliter for cancer patients. For renal patients, the target hemoglobin level is 11 grams per deciliter for patients on dialysis and 10 grams per deciliter for chronic renal patients not on dialysis. A patient with end-stage renal failure has been admitted to the hospital for severe anemia. She is refusing blood transfusions. The nurse anticipates drug therapy with which drug to stimulate the production of red blood cells? A. Folic acid. B. Cyanobalamin, vitamin B12, C. Epoetin alpha, Epogen, D. Filgrastim, Neupogen. Answer: C. Epoetin alpha, Epogen. Rationale: Epoetin alpha is a colony-stimulating factor that is responsible for erythropoiesis, or formation of red blood cells. The other options are incorrect. The nurse is administering intravenous iron dextran for the first time to a patient with anemia. After giving a test dose, how long will the nurse wait before administering the remaining portion of the dose? A. 30 minutes. B. 1 hour circa 6 hours. D. 24 hours. Answer: B. 1 hour. Rationale: although anaphylactic reactions usually occur within a few moments after the test dose, it is recommended that a period of at least 1 hour elapse before the remaining portion of the initial dose is given. The other options are incorrect. The client diagnosed with sickle cell anemia is experiencing a vaso-occlusive sickle cell crisis secondary to an infection. Which medical treatment should the nurse anticipate the HCP ordering for the client? 1. Administer meperidine, Demerol, intravenously. 2. Admit the client to a private room and keep in reverse isolation. 3. Infuse D5W 0.33% NS at 150 ml per hour via pump. 4. Insert a 22 French Foley catheter with a urometer. Answer: 3. Infuse D5W 0.33% NS at 150 ml per hour via pump. Rationale: increased intravenous fluid reduces the viscosity of blood, thereby preventing further sickling as a result of dehydration. Diagnosed with sickle cell anemia comes to the emergency department complaining of joint pain throughout the body. The oral temperature is 102.4 F and the pulse oximeter reading is 91%. Which action should the emergency room nurse implement first? 1. Request arterial blood gases stat. 2. Administer oxygen via nasal cannula. 3. Start an IV with an 18-gauge angiocath. 4. Prepare to administer analgesics as ordered. Answer. 2. Administer oxygen via nasal cannula. Rationale. A pulse oximeter reading of less than 93% indicates hypoxia, which warrants oxygen administration. The client's nephew has just been diagnosed with sickle cell anemia. The client asks the nurse, "How did my nephew get this disease?" Which statement would be the best response by the nurse? 1. Sickle cell anemia is an inherited autosomal recessive disease. 2. He was born with it and both his parents were carriers of the disease. 3. At this time, the cause of sickle cell anemia is unknown. 4. Your sister was exposed to a virus while she was pregnant. Answer. 2. He was born with it and both his parents were carriers of the disease. Rationale. This explains the etiology in terms that a layperson could understand. When both parents are carriers of the disease, each pregnancy has a 25% chance of producing a child who has sickle cell anemia. The client diagnosed with menorrhagia complains to the nurse of feeling listless and tired all the time. Which scientific rationale would explain why these symptoms occur? 1. The pain associated with the menorrhagia does not allow the client to rest. 2. The client's symptoms are unrelated to the diagnosis of menorrhagia. 3. The client probably has been exposed to a virus that causes chronic fatigue. 4. Menorrhagia has caused the client to have decreased levels of hemoglobin. Answer. 4. Menorrhagia has caused the client to have decreased levels of hemoglobin. Rationale. Menorrhagia, excessive blood loss during menses, does not cause pain. Fibroids or other factors that cause the menorrhagia may cause pain, but lack of rest or sleep is not responsible for the listlessness or fatigue. The symptoms are the direct result of the excessive blood loss. Some viruses do cause a chronic fatigue syndrome, but there is a direct cause and effect from the menorrhagia. Menorrhagia is excessive blood loss during menses. If the blood loss is severe, then the client will not have the blood's oxygen carrying capacity needed for daily activities. The most frequent symptom and complication of anemia is fatigue. It frequently has the greatest impact on the client's ability to function and quality of life. The nurse is admitting a 24-year-old African American female client with a diagnosis of rule-out anemia. The client has a history of gastric bypass surgery for obesity 4 years ago. Current assessment findings include height 5 feet 5 inches, weight 75 kilograms, P110, R27, and BP 104/66. Pale mucous membranes and dyspnea on exertion. Which type of anemia would the nurse suspect the client has developed? 1. Vitamin B12 deficiency. 2. Folic acid deficiency. 3. Iron deficiency. 4. Sickle cell anemia. Answer. 1. Vitamin B12 deficiency. Rationale. The rugae in the stomach produce intrinsic factor, which allows the body to use vitamin B12 from the foods eaten. Gastric bypass surgery reduces the amount of rugae drastically. Clients develop pernicious anemia, vitamin B12 deficiency. Other symptoms of anemia include dizziness and the tachycardia and dyspnea listed in the stem. Folic acid deficiency is usually associated with chronic alcohol intake. Iron deficiency is the result of chronic blood loss or inadequate dietary intake of iron. Sickle cell anemia is associated with African Americans. But the symptoms and history indicate a different anemia. The male client with sickle cell anemia comes to the emergency room with a temperature of 101.4 F and tells the nurse that he is having a sickle cell crisis. Which diagnostic test should the nurse anticipate the emergency room doctor ordering for the client? 1. Spinal tap. 2. Hemoglobin electrophoresis. 3. Sickle turbidity test, Sickle Dex. 4. Blood cultures. Answer. 4. Blood cultures. Rationale. The elevated temperature is the first sign of bacteremia. Bacteremia leads to a sickle cell crisis. Therefore, the bacteria must be identified so the appropriate antibiotics can be prescribed to treat the infection. Blood cultures assist in determining the type and source of infection so that it can be treated appropriately. Which sign, symptom will the nurse expect to assess in the client diagnosed with a vaso-occlusive sickle cell crisis? 1. Lordosis. 2. Epistaxis. 3. Hematuria. 4. Petechia. Answer. 3. Hematuria. Rationale. Vaso-occlusive crisis, the most frequent crisis, is characterized by organ infarction, which will result in bloody urine secondary to kidney infarction. The nurse is completing discharge teaching for the client diagnosed with a sickle cell crisis. The nurse recommends the client getting the flu and pneumonia vaccines. The client asks, "Why should I take those shots? I hate shots." Which statement by the nurse is the best response? 1. These vaccines promote health in clients with chronic illnesses. 2. You are susceptible to infections. These shots may help prevent a crisis. 3. The vaccines will help your blood from sickling secondary to viruses. 4. The doctor wanted to make sure that I discussed the vaccines with you. Answer. 2. You are susceptible to infections. These shots may help prevent a crisis. Rationale. An individual with SCA has a reduction in splenic activity from infarcts occurring during crises. This situation progresses to the spleen no longer being able to function, and this increases the client's susceptibility to infection, which is a potential complication that occurs specifically to a male client diagnosed with sickle cell anemia during a sickle cell crisis. 1. Chest syndrome. 2. Compartment syndrome. 3. Priapism. 4. Hypertensive crisis. Answer. 3. Priapism. Rationale. This is a term that means painful and constant penile erection that can occur in male clients with SCA during a sickle cell crisis. During therapy with the hematopoietic drug Epoetin alpha, Epogen, the nurse instructs the patient about adverse effects that may occur, such as a. Anxiety, b. Drowsiness, c. Hypertension, d. Constipation. Answer. C. Hypertension. Rationale. Hypertension is an adverse effect of hematopoietic drugs, along with headache, fever, pruritus, rash, nausea, vomiting, arthralgia, cough, and injection site reaction. The other options are incorrect. The nurse is administering folic acid to a patient with a new diagnosis of anemia. Which statement about treatment with folic acid is true? A. Folic acid is used to treat any type of anemia. B. Folic acid is used to treat iron deficiency anemia. C. Folic acid is used to treat pernicious anemia. D. The specific cause of the anemia needs to be determined before treatment. Answer. D. The specific cause of the anemia needs to be determined before treatment. Rationale. Folic acid should not be used to treat anemias until the underlying cause and type of anemia have been identified. Administering folic acid to a patient with pernicious anemia may correct the hematologic changes of anemia, but the symptoms of pernicious anemia, which is due to a vitamin B12 deficiency, not a folic acid deficiency, may be deceptively masked. The other options are incorrect. A woman who is planning to become pregnant should ensure that she receives adequate levels of which supplement to reduce the risk for fetal neural tube defects. A. Vitamin B12B, vitamin D-C, iron D, folic acid. Answer: D. Folic acid. Rationale: it is recommended that administration of folic acid be begun at least 1 month before pregnancy and continue through early pregnancy to reduce the risk for fetal neural tube defects. The nurse is caring for the female client recovering from a sickle cell crisis. The client tells the nurse her family is planning a trip this summer to Yellowstone National Park. Which response would be best for the nurse? 1. That sounds like a wonderful trip to take this summer. 2. Have you talked to your doctor about taking the trip? 3. You really should not take a trip to areas with high altitudes. 4. Why do you want to go to Yellowstone National Park? Answer: 3. You really should not take a trip to areas with high altitudes. Rationale: high altitudes have decreased oxygen, which could lead to a sickle cell crisis. A patient will be taking oral iron supplements at home. The nurse will include which statements in the teaching plan for this patient? Select all that apply. A. Take the iron tablets with meals. B. Take the iron tablets on an empty stomach 1 hour before meals. C. Take the iron tablets with an antacid to prevent heartburn. D. Drink 8 ounces of milk with each iron dose. E. Taking iron supplements with orange juice enhances iron absorption. F. Stools may become loose and light in color. G. Stools may become black and tarry. H. Tablets may be crushed to enhance iron absorption. A patient will be taking oral iron. Answer: A. Take the iron tablets with meals. E. Taking iron supplements with orange juice enhances iron absorption. G. Stools may become black and tarry. Rationale: iron tablets need to be taken with meals to reduce gastrointestinal distress, but antacids and milk interfere with absorption. Orange juice enhances the absorption of iron. Stools may become black and tarry in patients who are on iron supplements. Tablets need to be taken whole, not crushed, and the patient needs to be encouraged to eat foods high in iron. The nurse is administering liquid oral iron supplements. Which intervention is appropriate when administering this medication? A. Have the patient take the liquid iron with milk. B. Instruct the patient to take the medication through a plastic straw. C. Have the patient sip the medication slowly. D. Have the patient drink the medication, undiluted, from the unit dose cup. Answer: B. Instruct the patient to take the medication through a plastic straw. Rationale: liquid oral forms of iron need to be taken through a plastic straw to avoid discoloration of tooth enamel. Milk may decrease absorption. The nurse is teaching a patient with iron deficiency anemia about foods to increase iron intake. Which food may enhance the absorption of oral iron forms? A. Milk. B. Yogurt. C. Antacids. D. Orange juice. Answer: D. Orange juice. Rationale: orange juice contains ascorbic acid, which enhances the absorption of oral iron forms. Antacids, milk, and yogurt may interfere with absorption. A patient is to receive iron dextran injections. Which technique is appropriate when the nurse is administering this medication? A. Intravenous administration mixed with 5% dextrose. B. Intramuscular injection in the upper arm. C. Intramuscular injection using the Z-track method. D. Subcutaneous injection into the abdomen. Answer: C. Intramuscular injection using the Z-track method. Rationale. Intramuscular iron is given using the Z-track method deep into a large muscle mass. If given intravenously, it is given with normal saline, not 5% dextrose. The nurse is administering an IV dose of iron dextran. For which potential adverse effect is it most important for the nurse to monitor at this time? A. Anaphylaxis. B. GI distress. C. Black, tarry stools. D. bradycardia. Answer. A. Anaphylaxis. Rationale. The most important thing to be monitored during the intravenous iron dextran injection is the anaphylactic shock. This is because the drug may cause allergic reactions when given through the vein. Anaphylaxis is the condition of severe allergic reaction that occurs abruptly on administration of the drug. The gastrointestinal tract distress is impossible since the drug is directly injected into the vein and bypasses the GIT. The color of the stools does not produce any harmful effect on the health. Thus, there is no need to monitor it. The drug does not produce bradycardia. Thus, heartbeat needs not to be monitored. The nurse is teaching a patient about oral iron supplements. Which statement is correct? A. You need to take the medication on an empty stomach or it will not be absorbed. B. It is better absorbed on an empty stomach, but if this causes your stomach to be upset, you can take it with food. C. Take this medication with a sip of water. Then lie down to avoid problems with low blood pressure. D. If you have trouble swallowing the tablet, you may crush it. Answer. B. It is better absorbed on an empty stomach, but if this causes your stomach to be upset, you can take it with food. Rationale. The iron supplement should be given on empty stomach or with food when stomach gets irritated on empty stomach. It is not a compulsion to take the drug on empty stomach. It can be taken with food if it irritates the stomach. There is no problem of low blood pressure with the iron supplements. The tablet should be engulfed intact. Chewing it will render its effect half or null. The nurse is assessing an African American client diagnosed with sickle cell crisis. Which assessment data is most pertinent when assessing for cyanosis in clients with dark skin? 1. Assess the client's oral mucosa. 2. Assess the client's metatarsals. 3. Assess the client's capillary refill time. 4. Assess the sclera of the client's eyes. Answer. 1. Assess the client's oral mucosa. Rationale. To assess for cyanosis, blueness, in individuals with dark skin. The oral mucosa and conjunctiva should be assessed because cyanosis cannot be assessed in the lips or fingertips. The student nurse asks the nurse, "What is sickle cell anemia?" Which statement by the nurse would be the best answer to the student's question? 1. There is some written material at the desk that will explain the disease. 2. It is a congenital disease of the blood in which the blood does not clot. 3. The client has decreased synovial fluid that causes joint pain. 4. The blood becomes thick when the client is deprived of oxygen. Answer. 4. The blood becomes thick when the client is deprived of oxygen. Rationale. Sickle cell anemia is a disorder of the red blood cells characterized by abnormally shaped red cells that sickle or clump together, leading to oxygen deprivation and resulting in crisis and severe pain. A nurse is preparing to give iron sucrose to a 58-year-old patient and will monitor for which common adverse effect. A. Hypotension. B. Dyspnea. C. Itching. D. Cramps. Answer. A. Hypotension. The charge nurse is making assignments on a medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with iron deficiency anemia who is prescribed iron supplements. 2. The client diagnosed with pernicious anemia who is receiving vitamin B12 intramuscularly. 3. The client diagnosed with aplastic anemia who has developed pancytopenia. 4. The client diagnosed with renal disease who has a deficiency of erythropoietin. Answer. 3. The client diagnosed with aplastic anemia who has developed pancytopenia. Rationale. Pancytopenia is a situation that develops in clients diagnosed with aplastic anemia because the bone marrow is not able to produce cells of any kind. The client has anemia, thrombocytopenia, and leukopenia. This client could develop an infection or hemorrhage, go into congestive heart failure, or have a number of other complications develop. This client needs the most experienced nurse. Any nurse should be able to administer iron supplements, which are oral iron preparations. Any nurse should be able to give an intramuscular medication. A deficiency of erythropoietin is common in clients diagnosed with renal disease. The current treatment for this is to administer erythropoietin, a biologic response modifier, subcutaneously or, if the anemia is severe enough, a blood transfusion. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? 1. Palpate the spleen. 2. Take the blood pressure. 3. Examine the feet for petechia. 4. Examine the tongue. Answer. 4. Examine the tongue. Rationale. The tongue is smooth and beefy red in the client with vitamin B12 deficiency, so examining the tongue should be included in the physical assessment. Bleeding, splenomegaly, and blood pressure changes do not occur, making answers. The client is being admitted with folic acid deficiency anemia. Which would be the most appropriate referral? 1. Alcoholics Anonymous. 2. Leukemia Society of America. 3. A hematologist. 4. A social worker. Answer. 1. Alcoholics Anonymous. Rationale. Most clients diagnosed with folic acid deficiency anemia have developed the anemia from chronic alcohol abuse. Alcohol consumption increases the use of folates, and the alcoholic diet is usually deficient in folic acid. A referral to Alcoholics Anonymous would be appropriate. There is no connection between folic acid deficiency and leukemia, therefore, this referral would not be appropriate. A hematologist may see the client, but nurses usually don't make this kind of referral. The HCP would make this referral if the HCP felt incapable of caring for the client. The social worker is not the most appropriate referral. The client diagnosed with iron deficiency anemia is prescribed ferrous gluconate orally. Which should the nurse teach the client? 1. Take Imodium, an antidiarrheal. Over-the-counter, OTC, for diarrhea. 2. Limit exercise for several weeks until a tolerance is achieved. 3. The stools may be very dark, and this can mask blood. 4. Eat only red meats and organ meats for protein. Answer. 3. The stools may be very dark, and this can mask blood. Rationales. The stool will be a dark green-black, which can mask the appearance of blood in the stool. Iron is constipating. An antidiarrheal is contraindicated for this drug. Iron can cause gastrointestinal distress, and tolerance to it is built up gradually. Exercise has nothing to do with tolerating iron. The client should eat a well-balanced diet high in iron, vitamins, and protein. Fowl and fish are encouraged. The nurse writes a diagnosis of altered tissue perfusion for a client diagnosed with anemia. Which interventions should be included in the plan of care? Select all that apply. 1. Monitor the client's hemoglobin and hematocrit. 2. Move the client to a room near the nurse's desk. 3. Limit the client's dietary intake of green vegetables. 4. Assess the client for numbness and tingling. 5. Allow for rest periods during the day for the client. Answer. 1. Monitor the client's hemoglobin and hematocrit. 2. Move the client to a room near the nurse's desk. 4. Assess the client for numbness and tingling. 5. Allow for rest periods during the day for the client. Rationale. The nurse should monitor the hemoglobin and hematocrit in all clients diagnosed with anemia. Because decreased oxygenation levels to the brain can cause the client to become confused, a room where the client can be observed frequently, near the nurse's desk, is a safety issue. Numbness and tingling may occur in anemia as a result of neurological involvement. Fatigue is the number one presenting symptom of anemia. The client should include leafy, green vegetables in the diet. These are high in iron. Which lab findings would indicate to the nurse that the patient is responding favorably to Epoetin alpha? A. An increase in reticulocytes. B. Decrease in clotting time. C. An increase in platelets. D. A decrease in leukocytes. Answer. A. An increase in reticulocytes. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? A. Side lying with knees flexed. B. Knee chest. C. High fowlers with knees flexed. D. Semi fowlers with legs extended on the bed. Answer. D. Semi fowlers with legs extended on the bed. Rationale. Placing the client in semi fowler's position provides the best oxygenation for this client. Flexion of the hips and knees, which includes the knee-chest position, impedes circulation and is not correct positioning for this client. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? A. Taking hourly blood pressures with mechanical cuff. B. Encouraging fluid intake of at least 200 milliliters per hour. C. Position in high fowlers with knee gach raised. D. Administering Tylenol as ordered. Answer. B. Encouraging fluid intake of at least 200 milliliters per hour. Rationale. It is important to keep the client in sickle cell crisis hydrated to prevent further sickling of the blood. Answer A is incorrect because a mechanical cuff places too much pressure on the arm. Answer C is incorrect because raising the knee gach impedes circulation. Answer D is incorrect because Tylenol is too mild an analgesic for the client in crisis. The nurse admits a client who is in sickle cell crisis to the hospital. Which does the nurse prepare as the priority in the management of the client? 1. Pain management. 2. Fluid administration. 3. Oxygen administration. 4. Red blood cell transfusion. Answer. 3. Oxygen administration. Rationale. The priority nursing intervention for a client in sickle cell crisis is to administer supplemental oxygen because the client is hypoxemic, and as a result, the red blood cells change to the sickle shape. In addition, oxygen is the priority because airway and breathing are more important than circulatory needs. The nurse also plans for fluid therapy to promote hydration and reverse the agglutination of sickled cells, opioid analgesics for relief from severe pain, and blood transfusions to increase the blood's oxygen carrying capacity. A pediatric nursing instructor asks a nursing student to describe the cause of the clinical manifestations that occur in sickle cell disease. The student responds correctly by telling the instructor that 1. Sickled cells increase the blood flow through the body and cause a great deal of pain. 2. Sickled cells mix with the unsickled cells and cause the immune system to become depressed. 3. Bone marrow depression occurs because of the development of sickled cells. 4. Sickled cells are unable to flow easily through the microvasculature and their clumping obstructs blood flow. Answer. 4. Sickled cells are unable to flow easily through the microvasculature and their clumping obstructs blood flow. Rationale. All of the clinical manifestations of sickle cell disease result from the sickled cells being unable to flow easily through the microvasculature, and their clumping obstructs blood flow. With reoxygenation, most of the sickled red blood cells resume their normal shape. The nurse writes a client problem of activity intolerance for a client diagnosed with anemia. Which intervention should the nurse implement? 1. Pace activities according to tolerance. 2. Provide supplements high in iron and vitamins. 3. Administer packed red blood cells. 4. Monitor vital signs every 4 hours. Answer. 1. Pace activities according to tolerance. Rationale. The client's problem is activity intolerance, and pacing of activities directly affects the diagnosis. This is an appropriate intervention for iron or vitamin deficiency, but it is not for activity intolerance. This may be done, but not specifically for the diagnosis. This would not help activity intolerance. The nurse is discharging a client diagnosed with anemia. Which discharge instruction should the nurse teach? 1. Take the prescribed iron until it is completely gone. 2. Monitor pulse and blood pressure at a local pharmacy weekly. 3. Have a complete blood count checked at the HCP's office. 4. Perform isometric exercise 3 times a week. Answer. 3. Have a complete blood count checked at the HCP's office. Rationale. The client should have a complete blood count regularly to determine the status of the anemia. This is an instruction for antibiotics, not iron. The client will take iron for an indefinite period. Pulse is indirectly affected by anemia when the body attempts to compensate for the lack of oxygen supply, but this is an indirect measure, and blood pressure is not monitored for anemia. Isometric exercises are bodybuilding exercises, and the client should not be exerting himself or herself in this manner. A patient will be receiving darbepoetin as part of treatment for post-chemotherapy bone marrow suppression. Which finding is a contraindication to darbepoetin therapy? A. Pulse rate of 100 beats per minute. B. Blood pressure of 128/79 of a millimeter. HGC hemoglobin level of 11 grams per deciliter. DWBC count of 7,000 per millimeter. Answer. C. Hemoglobin level of 11 grams per deciliter.